So what is call spoofing? Call spoofing is the impersonation of legitimate healthcare providers or other industries when they interact with mobile subscribers or consumers. Essentially, the ability to impersonate a business is done through, in this instance, a mobile voice, through a voice call. This is quite easily achieved these days because there are many instances where social engineering or other fraudulent tactics can impact the way in which mobile subscribers view a business. And voice is very important to healthcare. There are some aspects which we'll go through in due course, but voice as a communication channel has seen many instances where there's been a negative impact on consumers and what they do, and how they view a mobile phone call. This may lead to missed calls, low call pickup rates in different areas, and voice is becoming increasingly susceptible to fraud. Call spoofing is a really good example of a very prominent reason as to why many mobile subscribers are unwilling to pick up a phone or view voice. They'd rather be communicated through other channels, whether that be messaging or email. However, as we'll go into, voice is most important to the healthcare sector because there are various countries that require impersonal or voice communications for the transaction of data. Mobile subscribers viewing phone calls almost as a nuisance. We see call spoofing in many other industries as well, diminishing the perceived value of voice, but it also has massive impacts on the healthcare sector. Looking to the right there, you can see that the generic screen for any phone call essentially has a logo, a name, and an answer to options to either accept the call or decline the call. There's no information on what the call's about. Within the healthcare sector itself, obviously, there's a lot of confidential or sensitive information that's shared between a healthcare provider as well as its patient. And voice is one of those key communication technologies that allows doctors and patients to communicate remotely, essentially. It's all about ensuring that information is secure and as confidential as possible. However, if with call spoofing impacting call pickup rates, it's becoming more and more difficult for healthcare professionals to use voice as a channel. As I mentioned before, there are many countries, such as the US and many in Europe, that require doctors to pass over certain information either in person or over the phone. And we saw with the global COVID-19 pandemic that in-person contact was not often achievable. We still haven't come out of that situation just yet in terms of doing everything in person. We're still focusing very much remotely. It means that voice as a channel in healthcare is incredibly important. And then just very quickly, I go over the negative impacts of call spoofing. So there's very different use cases for voice in the healthcare space. And I think, Shelley, you were going to take over and just talk some of this through on the right.
The majority of the use cases around healthcare center around booking and managing appointments, discussing test results, telephone-based patient support, as we just mentioned, managing prescriptions, managing payments insurance, and handling confidential and sensitive information. The private nature of healthcare-related matters often necessitates phone calls over other communication channels. So what is happening is that fraudsters are sometimes impersonating healthcare providers with the aim of monetary gain. With this fraudulent traffic, there's damage done to the reputation of the healthcare providers. This is totally out of control for folks in the healthcare industry, but the damages can be irreparable. This results in the loss of patient trust, which is really what we're trying to achieve with anti-spoofing and authentication, is the rebuilding of trust in that voice channel, in that voice communication.